Welcome to the What About Rural Health podcast, a place where research, policy, and real life stories come together to ask the critical question: what about the communities too often left behind? I am Chinasa, a development and global health policy strategist. And for me, this work is personal. From the village health workers struggling with limited supplies to the mothers working miles for care, their stories shape the policies we need. Join me as we uncover challenges, spotlight innovations, and amplify the voices of those at the heart of rural health systems. Because every community matters, and it is time the world listens. Hello and welcome. You are listening to the podcast that asks the question many forget: what about rural health? I'm your host, Chinasa Imo, and together we are uncovering the stories, challenges, and innovations shaping healthcare in overlooked communities. We are still in our introductory series, breaking down rural health issues, advocacies, policies, and systems reforms. And today's episode is titled Beyond the City, or what urban resistance can tell us about rural health realities. Before me here, we have Dr. John Schlichtman. Dr. Schlichtman is an urban sociologist and a community ethnographer, a thought leader on justice centered development. He's a professor of sociology at DePaul University, and his work examines how community resist, adapt to, or shape forces like gentrification, globalization, and structural changes, and what it means to build just people centered policy. Dr. John is, and I think at some point I'll just call him John, which is what I know him and refer to him as always. He is the author of Gentrifier and Showroom City, and he has a new book coming, which we would discuss later. We'll discuss now after I'm done introducing him. And I think it's such a privilege to have him talk about his unpublished book in our episode today. So his work brings, an accessible, reflective lens to the question of equity, resistance, and transformation. So you may wonder, how does an urban sociologist who spent majority of his career focused on the workings of urban spaces relate to rural health? Well, you are here to find out. The topic of today says that all, but his insights are very relevant to rural health, as they are also for urban planning. John's work has been featured in major outlets and journals such as New York Times, Bloomberg, City Lab, NPR, Next City, The Economist, and Architectural Digest. John has led one of the largest virtual network of urban thinkers. It's called Urbanist on LinkedIn. You can go check that out. It has over 90,000 members of urbanists that are part of that group worldwide. And he brings a justice centered approach to development that challenges how we think about power, place, and policy, making him an important voice in today's conversation on rural health. So, John, welcome to today's episode. So, tell me, I know that we've discussed a lot about your work, your academic life, and sometimes I think, your because professionals always talk about what they do, but sometimes you like to shift away from what you do and talk about who you are. So can you tell me a little bit about why you are writing your next book and what that next book is about?
That's an interesting question. So first of all, I'm a sociologist, not just by training or not even first by training, but just in the way that I look at the world, which means that You have any one given person, any one given individual with their own personal agency and ability to act. And then around that person is structures, social structures, or sometimes we just say structures, which are the fixed patterns of the world, seen and unseen, that shape that person's action and shape that person's perception. Um, so, you know, there is a place for holding individuals accountable. There is a place for personal agency. In our friendships, we hold our friends accountable. We never talk to our friends in terms of the structures that they're located within. We help to motivate them, but at the same time, we recognize what they're going through. So that's my approach towards communities, right? And so my new book was motivated out of my previous two books, looking at the arguments that people have over what just development looks like. And all of the vague statements that are made, all of the errors that are made, the way that people talk past each other. And so throughout my career, I have worked on equipping people to have better arguments, better debates. And so my goal is to reach broader audiences than just academia with each book, to help people understand, and this is getting to the current book, where communities have come from and where communities are going. So communities that have been devalued, both symbolically but also economically, there are plans in place to revalue those communities. And everyone has a different motive in the revaluation. And every community has a different story in the devaluation. So my third book is a handbook, basically, of what I call the threads of community history, which is what are all of the things, and I identify 11 things that a community can go through that would cause it to be devalued. And what are the 11 things that a community can go through that would cause it to be revalued? And so this brings a lot of clarity, because the minute we talk about a community being devalued, the conversation's not over, it's just beginning. Because you have all of these various threads that create a fabric of how this particular community got to this particular place. Now, when you come with a plan to revalue it, now those threads of revaluation, they're fitting into an old fabric of devaluation. And so my main breakthrough in this book, my main epiphany in this book, is that every community is completely distinct, but the threads that make it distinct, those 22 threads of 11 devaluation, 11 revaluation, are very common throughout the world. So if you examine those threads, you begin to compare places that people wouldn't think of comparing, and you get clarity that people don't normally get in these conversations when they just say, well, this area was devalued because it was redlined, and then that's the end of the conversation. So then what does that mean? What's the answer? And so my book helps to push those conversations forward. It doesn't provide the answers. It provides clarity in the discussion.
Yeah, thank you for that explanation. And I'm curious, and I just need to do a full disclosure that I've seen those frameworks. So, and I'm going to ask you questions that bug my mind, like when you talk about 11 and 11 of the devaluation and revaluation frameworks, and what usually struck me when I think about this in relation to places and efforts in the way they are, whether from government or individuals themselves within the community, making meaning of how their environment is becoming devalued and what they think would make an improvement if certain changes are done. And sometimes I try myself to pair these things together between, okay, if a devalued factor is here, should we apply an alternate force? And sometimes that's not the way, because there are underlying things that could be making what we are seeing look the way they are, but the force that need to repair it are not directly matched. Would you say a little bit about that?
Yes. So I think this is the number one way that communities are exploited, is in the marketing and the promotion of what seems to be common sense plans. That if this community was defunded, then we need to refund it. Conversation over. If this community was detached, we need to reconnect it. Conversation over. If this community was deteriorated in its housing stock, then we need to renovate it. And when you look at communities from a fabric approach, you can't undo the fabric that's already created. You can't go back in history. So, there is a craze around the world right now in wealthier nations of removing roads that were unjustly placed. But I think this is the most obvious example, like removing a road 60 years after the community didn't want it there might not be the number one way to address that issue. So another analogy that I use, and there's two analogies in the books. One is a fabric, and one is the making of a loaf of bread. You put in all these ingredients to the loaf of bread, and it becomes something new. You can't go back 3 days later and take out the eggs. You can't go back later and add the chocolate chips that you wish you added, and with the fabric, you can't go back later and take the red threads out that you don't like. So I think it provides a framework like this, shows us the messiness and the nuance of community building, which I think are the two things that are most lost in conversation, because everyone wants an easy side to be on and an easy side to articulate. And everyone wants to have an obvious, quick answer that you can put in a one-page document.
Wow. I know some of our listeners will be wondering, why am I asking an urban sociologist to talk about, spaces and stuff when we are asking the questions around, rural healthcare? And that brings me to a follow-up question. I looked at the frameworks and I teased out specifically four of those devalued frames that you put together. And I want us to talk a little bit about it because they jump to me as very relatable when I'm thinking about place-based policies and how they affect, healthcare accessibility. And these four frameworks are defunding, and you mentioned it when you were speaking the other time. The second one is detaching, and by your definition, like when you detach people, or by my understanding, when you detach things from the services that they used to receive before. And then the third one is destabilization. And then the last one is deterioration. I bring these four questions specifically because when we look at rural communities, there's always that inherent um, challenge of health facilities, being left to deteriorate because of other things that I could still tie back to defunding and other kind of things. And, that struck me as, yes, this is something that I want us to spend a little bit of time to talk about. And I know you might disagree. Oh, I don't see the direct relations between rural healthcare accessibility and all of these frameworks
Well, you
that
know that's my perspective. So you know I was asking you why you want me here. So
yes.
yes,
So I mean, I know you can disagree,
yeah,
but when I look at it from that place-based
sure,
issues,
sure.
I want you to just like tell me about these four frameworks, how you see them play out in communities. And looking at the examples that I have given to you, what was running through your mind when you structured them?
Well, I mean, these are very, very common threads that communities face. So you said defunding, deterioration,
Detaching,
detaching, and
destabilization.
destabilization. And you did say deterioration.
Yes, I
Yeah.
did.
Um, so deterioration is, so in my definitions, deterioration is the physical decline of the place, which becomes very, very costly. When a place is when a place is built environment, and built environment is just all of the things that were made by people.
Mhm.
So when a place's built environment or all the things that have been made by people begin to deteriorate because of a lack of maintenance, then the whole conversation changes. I mean, so, well-known example in the United States is Congress allowed US public housing to deteriorate by not funding regular maintenance. And so the conversation's able to change into something like, well, we need to demolish it, which is another thread. But deterioration is also important because deterioration helps to create health hazards in terms of lead, other things asbestos, other things that decaying buildings might have. Um, Community destabilization relates to the social weakening of the community. So if you have a community that's weakening in its social fabric and also weakening in its physical buildings, you have a momentum that's very hard to overcome. And so these are just two reasons why a neighborhood would become detached. And when I say that a neighborhood is detached, I mean something very specific. It's a real or perceived reduction in a neighborhood's resources, its functions, its purposes, its assets, its safety in the minds of outsiders. So people from outside that neighborhood. And so what this means in urban planning talk is that this neighborhood disappears from the cognitive or mental map that people have of the city. So they have a map of the city in their minds, and there are murky places, blurry places, what one leader famously and horribly called holes on the map. And so that begins to have its own momentum. Once a place begins to disappear, that becomes its own driver for housing to become devalued because people aren't looking at that housing or wanting to live in those apartments. Retail becomes devalued because the only clientele is a local clientele. So that would be detaching. And then defunding is a decrease in government support for buildings, for infrastructure, for businesses, for spaces, for programs. And, governments oftentimes try to, especially in a conservative leaning, right leaning government, where community is looked at through a business lens, the idea is this community is a bad investment, so we're going to take away our funding from it and put our funding in some place where that deserves it. And this results in what is known and what I call in the book a containment strategy, where it's like, okay, this area is going to have problems because of all of these issues. We're going to have to, the government says, create a boundary around this neighborhood and make sure that all of those issues are contained within this area so it doesn't blight, pollute the rest of the city. And that becomes an entire strategy around urban planning and policing, et cetera.
Wow.
And so in many countries, the decanting or relocation of people from prime urban areas to the rural periphery is a strategy to remove many of these issues out of sight.
Wow. That's very insightful. And when you were talking, my mind just went through a time that I was doing a documentary on hospital functionality, specifically primary health care. And most of about 75% of the hospitals that I went to were so deteriorated that you would think you are coming there to pick diseases and not getting,
Not,
and not getting care.
yeah.
So, and when I look around, like when you were mentioning about deterioration of building, and I think you called them, bio waste, like in relation to hospital setting, that would be medical waste. Now imagine when, because of deterioration, the pipes, the sewages are not working, and the hospital, the doctors still need to work, they need to function, women still come there to give birth, and all those wastes are not properly managed because they have a whole lot of structural problems within the health facility to grapple with, and that becomes a huge problem. Well, you are still listening to What About Rural Health? We are going for a short break. When we come back, our guest will dive into the deeper conversations that are, coming out from his other book, Showroom City. Welcome back. You are still listening to What About Rural Health with Chinasa. So, John, let's dive into Showroom City.
If you insist.
I do insist because, see, the thing is, when I read that book, and I took away, because you are an urban sociologist. I am not. I'm an administrator. I look at things from public perspective, and how does that inform public policy? How does, you know, community action inform change? That is what I'm looking out for. And that is a whole lot of things that the book was telling me when I read them. And when I read it. So I still want to bring it in, and we'll talk about it, and then we'll come back to these frameworks. So your work in Showroom City, it ties directly, it ties real estate to urban changes that shows broader social impact. And you've discussed a whole lot about these from the framework. But when you think about these spaces, how do you think it shapes people's health and well-being?
So the question is, how do spaces shape health and well-being?
Yes.
I mean, I think, one of the benefits of this moment is that we are thinking about health in regards to the social determinants of health.
Yes.
And
exactly.
so if you think about that individual and you think about all of the things that surround that individual, you think about the air, around the individual. How polluted is that air? What is polluting that air? How noisy is that place? Can the person sleep? How stressful is the noise? Is the noise itself threatening? Is it bombing? You know, so you think about the air around someone. You think about the soil that's available, the lead in the soil, the pollutants in the soil, and the weather around that individual. Places that are heavily paved and the heat island that envelops those places because there's not the natural ecosystem to be able to handle heat. You think about how easy it is for that person to walk around and get to other places, not just walk around within the neighborhood, that's one piece, but to get around to other places. The food that's available to that person, the housing that that person's living in. Is there mold in the housing? Is there lead in the housing? The healthcare that's in the area. And then you begin to look at the social cohesion, the social capital, the what we would call the glue between people. And so I think that's one of the things that devalued, marginalized neighborhoods have oftentimes in abundance is social cohesion. And I think that is where plans that are successful in addressing all of these other things about the environment, air, soil, noise, pedestrian access, housing, food, health. Oftentimes, successful plans will leverage the cohesion, the social glue, the social capital that's already in place. And I think, major institutions, you're more familiar than I, but major institutions like the United Nations and others are leaning on this type of perspective now as a default, even if it's only in rhetoric, in a way that's never occurred before. So it's almost the new common sense that the local has expertise, that community cohesion, that those community relationships, that there's expertise and know-how in it. Now, whether that actually is acted upon, whether that know-how is actually respected, whether community input is just a symbolic stage, that's a whole nother thing. But I think, these are the social determinants of health, which I've basically overviewed here. Like, this is a great way to understand where a community sits and then how it can move forward. So I think, in the High Point case, this was the case of a city that lost it. This is the subject of Showroom City, is High Point, North Carolina, which is a city that lost its downtown because its downtown became the setting for a global exposition of furniture, fashion that occurred twice a year, so that the whole world, every continent would come. 85,000 visitors from 110 countries would come to this downtown, and the place lost their community center and therefore lost a lot of the mechanisms they had for cohesion and glue and social capital. And so this book is largely about that. It's a very, very unique and strange, one review called it weird, case that helps to highlight very common threads. And again, this is one of the things that led me to this thread approach, that as strange as High Point is, the threads that make it into what its strangeness are very common.
Yeah. Yeah. And thank you for that response. And thank you for drawing social determinants of health to this conversation. Because, when we talk about healthcare, and I think I usually make this point so much, that we are not just focusing on the medicalization of the healthcare system where you become sick and you go get help, but the constitution of everything that makes you a healthy being, and spaces are part of that. And when you mention social cohesion, I just smile. I'm like, it is only an ethnographer who would, take time to study humans, people, and how they function within society, how they build this social cohesion. And I would add that in some cases, even how they disintegrate. It is still within like human to, move from being discomfort to taking action. And you being an ethnographer.
If I could just say, like,
Yes.
we're at a moment in history where doctors and sociologists are discovering each other. And public health has not bridged that gap. Like, public health has not bridged the gap between the people who look at individuals in structures, which are sociologists, and the people who provide medicine, which are doctors. And we are in a moment right now where, like, everyone's learning from each other. So I'm hoping that 20 years from now, you'd never have someone like me on this podcast, because we would have moved past a place where I would have something useful to say, even though I don't do rural health, right?
I agree with you. I agree with you. I went to a global health conference in DC 2 years ago, and that became the frame of the conversation. Like, we're talking about public health, and things were still being typified around, health communication and promotion, one bucket, right? Surveillance and in one bucket, right? And laboratory services in one bucket. And then medical practice in one bucket. Everything, even when we talk about public health, things are still bucketed. For instance, when we talk about rural health, people think, oh, okay, it's rural spaces. Yet we have seen the migration of diseases from, water, contaminated water, to the global space. Where everybody grapple with both in the urban and rural spaces. So all these things are interconnected. And sociologists do this by studying why are these things happening within social spaces, right? Doctors do what they do, but if they open up spaces to think that what is presenting before them in the hospital are a combination of all of these other things put together. And if we just open up that space to understand this, and begin to see that the decisions that you make, does not just begin and end with you. There is someone else making conscious decision that may facilitate or destabilize your work. And if we look at it from that interconnected spaces, the world will be better. I think so.
Yes. And so, I think that people are specialists.
Yes.
And they want to bring the thing that they specialize in to the group that they think needs it. And I think that's where a lot of damage is done. A famous insight or a well-known insight from policy, and I can't remember, who was the first to state it, but that the policies of today fix the problems caused by the policies of yesterday. The things that we consider social problems today are the answers from yesterday.
That's true.
And so to have the humility of saying that there's so much more going on than this one area that I specialize in. So, like, to give an example, like, the person who wants to bring transit cannot understand why someone would not want a transit stop. They think that they must be naive, when in fact it could be the transit stop proponent who's naive, because they're not looking at all the various factors.
Yeah.
Someone who says, I want to bring a bike lane. That's my life's work. And someone says, no, I don't want a bike lane. And the response is, that's naive. No, the person bringing the bike lane is probably the one who is naive. You know, solving a food desert with a Whole Foods, that seems like an obvious thing for the person who wants to bring the best. Well, we don't just want any grocery store. We want a Whole Foods. But that's not looking at the whole picture. And so I think this holistic approach is very complicated. It's also very difficult to politicize. You see mayors in Chicago and now in New York in that election trying to talk about a totality of issues that result in individual well-being. And it's very difficult to pursue that today. That's the question. Other nations have had a more holistic view of the individual,
That's
a
true.
more societal view of the individual. The US in particular has been individualistic to a fault, had so much to learn from other nations. Many of those nations, its communities, the US has ruined with this individualism. But I think it's very difficult to say, well, how do you help this individual who's sick? Well, you do it through transportation. You do it through grocery stores. You do it through sidewalks. You do it through green space. That's a very difficult thing to run for, to have a platform as a mayor.
That's true. Thank you for that response. And we are still on Showroom City, and having a conversation around that. But I want to ask you a question. By your profile, yourself, you always describe yourself as both a teacher and a student, and that's kind of like puts you in a place of both teaching and learning of community sociology and how you use that to approach your work. I, while putting together this, I'm like, what do I hit him with? What question do I hit him with that would allow him to talk about his academic work, right? We'll still come back to Showroom City. And I got fascinated in your use of asset-based community-led development model. And, within this context, how can we use that to understand health equity generally?
I think asset-based community development is used quite often for health outcomes. Because I think health outcomes are kind of the most social of our outcomes. We could also put maybe education in that, that it takes all of these determinants to create an educated child. But really, health is something, you think about mental, physical, spiritual health. It's really something that brings together all aspects of society. And so asset-based community development is very, very straightforward. It looks at places from the lens of their strengths rather than their deficiencies. And it says, what are the strengths of individual talents in a place? What do these residents do better than anyone? Or what can they do that others can't do? What are the physical assets of this place? Like, what are the buildings? What are the plazas? What are the trees? Because, some communities, a 200-year-old tree might be one of the most important meeting spaces in that community. So what are the physical assets of that community? And then institutions, what are the organizations that maybe some of them inhabit those important buildings? What are the organizations that are the strengths of that community and the association. So things that are less formal, residents that get together around savings clubs or things like that, which may actually become more formalized in the future. And then culturally, what are the things that this community wants to retain and develop? So looking at a community through the lens of its strengths and moving forward from there, that's the only type of development that can possibly be sustainable.
That's true.
Because that's the only type of development that respects what the current fabric is and weaves into that current fabric. Most other plans are to create a new fabric. And that's how development has operated around the world, from the removal of informal settlements to the demolishing of public housing, is the declaration of we need a new fabric, and by elected officials and appointed officials. And while that can seem like a very neat and clean answer, and even a very profitable answer, if you are turning that land into something that makes more money and has higher rent, the societal costs of that, and I don't just mean the social costs of that, I mean the economic costs of that.
Okay.
So the costs of people who had social cohesion now no longer having social cohesion.
Mm-hmm.
The cost of places that had networks of kids that knew each other and were growing up together, now no longer having those relationships for kids. The businesses that catered to local people, that allowed them to get discounts until they got paid, or maybe not pay for something until payday, that being lost. Like, all of those things being lost increases issues like health problems, increases issues like crime, that all have economic, not to mention the lost productivity, the lost productivity of that local business being gone, of people who were living close to potential livelihood, their proximity to jobs being gone. So it's really comes down to the issue of short-term economic costs and profits, and long-term economic costs and benefits. All of these things that we are doing for short-term profits have long-term economic costs.
That's true. Thank you, Dr. John, for coming to our show today. And for our listeners, I would invite you to stay with us, listen to the podcast, and if there's something that you learn out of it, please share to your audience as well, and leave us a review. You are still listening to What About Rural Health? Because health isn't just about systems, it's about the people those systems are made to serve, how they make meaning of the places they call home, which sometimes are left behind. That is why we continue to ask this question: what about rural health? Let's create this together. Until next time, I'm still your host, Chinasa Imo. Thank you. Bye.